21st-century maternity nursing? Must-know concepts 1. Maternity nursing. Maternity nursing includes care during preconception, planning for pregnancy, prenatal, antepartum pregnancy, intrapartum, labor and birth, postpartum, first 6 weeks after birth. Perinatal term used to describe these periods collectively in this chapter. 2. Major current problems. Know these high-yield issues. Maternal mortality is increasing in the United States. Chronic diseases, heart disease, diabetes, obesity, contribute. Significant racial disparities exist. Non-Hispanic Black women have a much higher pregnancy-related mortality risk than non-Hispanic white women. Lack of postpartum access to care and shortages of midwives are identified as contributing factors. 3. Nurses' role. Nurses provide prenatal care, teach childbirth and parenting classes, care for women during labor and birth, care for high-risk mothers and newborns, educate about pregnancy, labor, newborn care, postpartum recovery, and parenting, promote evidence-based practice, and influence health policy. Health disparities. Know these points. Minority groups experience higher maternal and infant mortality. Social determinants of health strongly influence outcomes. Healthy People 2030 emphasizes health equity, elimination of disparities, health literacy, healthy environments, well-being across the lifespan. Healthy People 2030 know the 5 goals. 1. Healthy lives and well-being. 2. Eliminate health disparities. 3. Improve social, physical, and economic environments. 4. Promote healthy development across life stages. 5. Encourage leadership and policies that improve health. United Nations Sustainable Development Goals. Examples include no poverty, zero hunger, good health and well-being, quality education, gender equality, clean water, reduced inequalities, climate action, partnerships for the goals. Integrative healthcare combines conventional medicine with complementary therapies. Examples: acupuncture, massage, yoga, meditation, herbal medicine, biofeedback, guided imagery, interprofessional education, IPE. Purpose: improve patient outcomes through collaboration. 4 competency domains. 1. Values and ethics. 2. Roles and responsibilities. 3. Communication. 4. Teams and teamwork. Problems in the U.S. healthcare system. Know these. Fragmented and expensive system. Limited access for many patients. Medical errors remain a major concern. Nurses help reduce errors through safe practices and teamwork. High healthcare costs continue to be a challenge. Safe practices. Remember, measure safety culture, obtain informed consent using TeachBack, communicate patient information clearly, perform proper hand hygiene, serious reportable events. Know these examples: maternal death or serious injury during a low-risk labor/birth, neonatal death or serious injury during a low-risk labor/birth, artificial insemination using the wrong donor sperm or egg. Historical milestones. High yield. Know these years. 1953 APGAR score. 1960 birth control pill introduced. 1962 thalidomide linked to birth defects. 1967 Rho-D immune globulin. 1972 WIC program. 1978 first test tube baby, Louise Brown. 1996 folic acid fortification. 2006 HPV vaccine. 2010 Affordable Care Act. 2016 Zika virus. 2020 COVID-19 pandemic. Maternal risk factors. Must know. Diabetes mellitus is one of the most common maternal medical risk factors. Hypertension associated with pregnancy is also common. Maternal obesity increases both risks. NCLEX tip. Think diabetes plus pregnancy hypertension. SBAR communication. SBAR stands for S. Situation. B. Background. A. Assessment. R. Recommendation. Purpose: reduce communication errors. Improve patient safety. Modern maternity nursing. Current nursing practice focuses on evidence-based practice, teamwork, collaboration, care across pregnancy, birth, postpartum, clinics, homes, and birth centers. Best way to reduce infant mortality. Highest priority: early and consistent prenatal care. Prenatal care allows early diagnosis, early treatment, better maternal and newborn outcomes. Health literacy. The nurse should use simple language, Avoid medical jargon. Speak slowly. Confirm understanding using TeachBack. Biggest barrier to prenatal care. Answer: inability to pay. Other barriers: transportation, childcare, lack of insurance. Evidence-based practice. Evidence-based practice uses: research, clinical trials, current scientific evidence. Professional nurses should identify research problems, apply research findings. Safe nursing practice. If unsure about a procedure, consult agency policy. Follow the procedure manual. Do not rely only on coworkers or textbooks. Complementary and integrative care. Complementary therapies. Respect patient beliefs. Focus on the whole person. Integrative care combines conventional medicine with complementary therapies. Nursing legal concepts. Know these terms. Accountability equals legal and professional responsibility. Standard of care equals care expected from a reasonably prudent nurse. Negligence equals failure to meet the standard of care. Social media. Biggest danger: violation of patient privacy and confidentiality. Remember, never post patient information online. Current childbirth trends. Know these facts. Almost all births occur in hospitals. Cesarean birth rates have increased. Breastfeeding immediately after birth is encouraged. Rooming in is encouraged. Episiotomy rates have decreased. Midwife care. Certified nurse midwives care for low-risk pregnancies. Encourage shared decision-making. Usually perform fewer interventions. Can practice in hospitals, birth centers, and homes. Female genital mutilation. Nursing care. Be culturally sensitive. Assess for complications. Avoid judgmental language. Joint Commission do not use. Unsafe abbreviations. QOD. IU. MSO4. Magnesium sulfate. No leading, zero omission. Safe practice. Write medication names completely. Always use a leading zero, such as 0.4. Healthy people priorities. Progress includes fewer fetal deaths, more prenatal care, continuing problems, low birth weight, preterm birth, racial disparities, family-centered care. The nurse should include the partner, encourage family participation, allow patient choices, collaborate with the family, patient safety. Remember, hand hygiene. TeachBack. Proper documentation. Follow CDC guidelines. Reduce unnecessary radiation. Obtain informed consent. High-yield NCLEX pearls. Diabetes and pregnancy hypertension are the most common maternal medical risks. SBAR improves communication. Early prenatal care is the best intervention to reduce infant mortality. Inability to pay is the greatest barrier to prenatal care. Evidence-based practice drives modern nursing. Follow agency policy when uncertain. Accountability means legal responsibility. Standard of care determines negligence. Patient privacy is the greatest social media risk. Certified nurse midwives safely manage low-risk pregnancies. Family-centered care promotes patient choice. TeachBack verifies patient understanding. Use only approved medical abbreviations. Integrative care combines conventional and complementary therapies. Hospital births remain the most common in the United States.